So my research particularly focuses on a localized provoked vulvodynia, which is chronic pain that happens upon touch. So it usually causes a lot of problems with tampon usage, riding a bicycle, wearing tight pants, and of course engaging in penetrative intercourse. And this affects roughly 8% of people with vulvas or women in the United States at present. But it's probably a gross underestimate because many of these women don't actually seek clinical care. And if we think about vulvar disease more broadly, what we know is that pretty much every person that has a vulva is going to experience pain and discomfort in this area at some point in their life. Sometimes it's just transient, say following an infection or childbirth or genital urinary symptoms of menopause, but it's inevitable. And so it's a very big problem that's often underlooked, and it affects everyone. It doesn't really discriminate with race, although it tends to be more diagnosed in Caucasian patients. And this has something to do with access to care and awareness in these populations. So the epidemiological data says it affects everyone, but it's certainly underdiagnosed in people of color and people of Hispanic ethnicity. So in our research, what we found is that with chronic vulvar pain, the first thing that happens is there's inflammation. So there's this ring of tissue surrounding the vaginal opening. And if you think about the anatomical position, it's like the moat around the castle. It's set there to protect against vaginal infection. But what unfortunately happens in patients that have vulvodynia is that areas become intensely sensitive to inflammatory stimuli. So that even parts of your normal flora that should be protective or healthy are eliciting a response, and then these patients end up having this unresolved inflammation it causes chronic pain. Part of that is because in those patients, the mechanisms for resolution seem to be deficient, so that these patients can't adequately resolve that. So I think SPMs are very promising therapeutic. So the data that we have from in vitro patient samples taking primary cells from patients, looking at tissues from patients and fluids, as well as modeling this in animals, is that the supplementation with exogenous SPMs, whether they're more natural product based like DHA or fish oil derived products, or the more highly purified or chemically synthesized specialized pro-resolving mediators themselves, is that they resolve pain that goes on for months in our animal model in a matter of a couple of weeks to 4 weeks at most. And so I think that because of their relative safety profile, they'll be excellent therapeutics for topical application and would save many of these patients from invasive surgeries. So the main curative procedure at this point in these patients is to remove that ring of tissue that surrounds the vaginal opening that's the source of pain. It often takes years before patients reach that point. It is very successful, but the problem is that it's an invasive surgery and comes with any of the risks of any other surgery. So we're hoping that these SPM products will be eventually available, hopefully within the next decade, and will replace some of these more invasive things. But also, it would probably have lots of positive effects for people that have vulvar pain even transiently. So it could represent a product that could be used really globally for any type of vulvar irritation. So we are on the verge of conducting our first clinical trial in conjunction with SPM Therapeutics. So we are currently working with the FDA to design a phase 1/2 trial for topical application. So hopefully within the next year or so, we'll start enrolling patients at some different university sites and soon have some idea of whether it's safe and what the promise is. I'm pretty confident it will be safe, but we're really excited to get some efficacy data in humans. So that's an excellent question. Everyone always wonders about the opportunity to use polyunsaturated fatty acids in the diet to modify. Unfortunately, because there is such a limitation of research in women's health, particularly when we're talking about vulvovaginal disease, we have no direct evidence to know that if you consume those fatty acids that they're going to be delivered to the site. The closest tissue that's been sampled is the rectum. But there are several studies out there that have looked at diet and vulvodynia. So there's been some thoughts that certain metabolites in the urine can cause irritation to the skin. And what we learned in looking at some of these diets is that some of the things that are limited are the consumption of linoleic acid, which is converted to arachidonic acid. And the pathways we've uncovered, arachidonic acid metabolism seems to be problematic, where we're skewing towards inflammation instead of resolution. So it's possible that these diets that have limited the sources of arachidonic acid in the diet could potentially explain some of their effects. There's certainly a lot more research will need to be done to investigate that. So I take my fish oil supplement daily, and my husband swears that it's highly effective. So I certainly don't think it can hurt as long as you're consuming these in a safe way. So obviously, the FDA and other entities recommend that you limit how many fish meals that you have per week because of the risk of mercury contamination. But aside from that, I really think fish oil is a great thing. Fish is one of my favorite foods.